Today, actually, we're talking about a very interesting subject, and you'd be surprised that I'm talking about who should not get implants because there are certain cases which are not indicated for implants. One, children who are growing up. If their skeletal growth is not yet complete, they are not ideal candidates for implants because later, when the skeletal growth happens, these implants can go deeper inside, and then restoring these implants become challenging. Number two is someone who cannot maintain good oral hygiene because of geriatric or whatever reason. Just because you got implants doesn't mean you stop taking care of your oral hygiene. So this is, I would say, number one cause, because children, we obviously don't do it. But number one cause is someone who cannot take care of their good oral hygiene. Implants definitely don't get cavities, but they can get gum disease like peri-implantitis, because of which these implants can fail or the body rejects these implants. Number three is someone who's a smoker and wants to continue smoking. That means, he's a smoker, he won't reduce, or he wants to continue smoking and smoking at a very high, like a chain smoker or someone who's very high into smoking. There, the percentage of success of an implant comes down from 98% to 79%, which is statistically very significant, though there are a lot of smokers whom we do implants. But this is over a 10-year period, very statistically important that they know that, this is where the success or the body could reject an implant because of infection or less blood supply to the tissues there, because of which these implants can fail. Number three is uncontrolled metabolic disease like diabetes. Just because you are diabetic doesn't mean we don't do implants. We do implants for a lot of diabetics who are insulin dependent diabetics, type 1 diabetics, as long as they're able to maintain their diabetics under control. Anything below 7.4 is good. And if the diabetic levels or the glucose levels fluctuates a little bit, doesn't matter. But the glucose level, and on a average, you should have that, the glucose level is maintained in the correct range. So just because if it fluctuates 1 day or 2 days, so if there is the glucose levels goes above 300 350 for more than a week, 10 days, even your teeth start shaking. So implants are nothing new, they can also shake and they can also come out. Last but not the least, but some very rare cases, when post implant surgery, where they have undergone chemotherapy or radiotherapy, these implants can again fail in these patients. Or sometimes post chemotherapy, they are on certain drugs like bisphosphonates, which are not indicated for implants, because the osteoclastic activity of the implant, which is the bone remodeling phase, is stopped by these drugs, and that is when it becomes difficult for these implants to integrate. So barring these four reasons, implants enjoy a 98% success rate. In medical language, if we say 98, it's like a 100% success rate. And we have seen implants which have lasted for more than 3 decades. That's like a lifetime in a patient's life. So implants can last a lifetime provided you take good care of them, you follow the instructions of your dentist, see your dentist regularly, and then these are implants that can be living like your third dentition.